Pain neuroscience education has now been so widely discussed and used that I think many people know what it is, or at least have heard of it. And 30 years ago, that wasn't the case. It was the focus of research and clinical translation into practice for a long time. Now we have enough of that data to really say how it can be helpful and how it might not be as helpful as we hoped it would be. So I think practically speaking, the responsibility on the clinician side is much heavier now to understand the science, to integrate the science, to unlearn some of the science that we formally learned in our academic training programs. And when we have that deeper, richer knowledge base, then we can select our education modes for the individual in front of us. Sense making, or helping someone understand what pain means and what it doesn't mean, can address some of the fear related to avoidance activity or avoidance of activities that are painful, which keeps people from doing things that their bodies need to be healthy. And of course, this leads to some other, deconditioning consequences and ways that people move far away from their valued activities and quality of life. So some strategies that a clinician might be able to use is first inform yourself. Inform yourself, recognize that we were perhaps taught some things in our academic training programs that were not consistent with modern science and understanding pain, the neuroscience of it, the neurobiology of it, the immune function that is now much better understood in how pain is maintained. So if you don't understand the basic science yourself, you're going to be limited in the tools you have available to help a patient understand it as well. Number two, to bring into the discussion with the patient, start simple. Think of a metaphor, have an analogy, have a story. Know the person in front of you enough that you can grab from a selection of different options and help that person make sense from what he or she is living. That lived experience of pain we know is really important. So connecting on a personal basis and developing a therapeutic alliance is probably more effective in helping someone get better than knowing a whole bunch of science and repeating that in front of a person. And then finding strategies that help a person feel safe in his or her body, I think, is key. And not just for those of us who specialize in the movement systems like physical therapists or chiropractors, but pharmacists, psychologists, people who may feel that's outside their scope, but helping someone feel safe in the body that carries them around is ultimately the goal for any rehabilitation effort in chronic pain care or even acute pain care. If you don't feel safe moving and you don't understand what pain means and you don't know the science of pain, you can't trust that it is safe to move when it hurts.